Good day, I'm Pearl Angeles Sabao from BSN 1B, and today I will be doing the assessment of the skin, the hair, and the nails. So to begin with the procedure, first we will introduce ourselves to the patient or the client, and then we will verify the client's identity and discuss or explain the procedure we will be doing to the client, why is it necessary, and how the client can cooperate with us during the procedure. Okay sir, good day po. I'm your student nurse for today. I'm Pearl Angeles Sabao po. May I know your name, sir?
John Ray po.
John Ray what po? Yung surname po?
Sabal po.
Okay, sir. How old are you now po, sir?
15 po.
Okay, sir. May I check your wristband for a while po? Okay, sir. Thank you po. Okay, sir. Today po, I will be assessing your skin, your hair, and nails po to determine or to observe for underlying problems po and to determine your health status. Is that okay with you, sir?
Opo.
Okay, sir. During the procedure po, can you cooperate with me by telling what I say or sundan niyo po yung mga sinasabi ko para po mapabilis yung ating assessment? Okay lang po ba yun?
Yes po.
Okay, sir. Thank you po. And after that, we will need to perform hand hygiene and we will need to observe for other appropriate infection control. And then after performing hand hygiene, we will now assemble our equipment. For this procedure, we will be needing a millimeter ruler, magnifying glass, and examination gloves. So after we assemble our equipment, we will need to provide for the client's privacy and dignity. If the client is in a ward, we need to close the door around, or we need to close the curtains around the bed, and if the patient is in a private room, we need to close the door of the room if possible. Now, we will proceed to the assessment of the skin, but before that, let me perform hand hygiene again. So in assessing the skin of the patient, first we will need to determine the client's history of the following. First, for pain or itching. Okay, sir, may mga nararamdaman po ba kayong pananakit sa balat or pangangati, mga ganun po?
Wala po.
Okay, sir. Also, we need to assess for any presence or spread of lesions, bruises, abrasions, or pigmented spots. Okay, sir, meron po ba kayong meron po bang mga lumilitaw na spots or mga bukol-bukol, lesions, mga abrasions? Wala po?
Wala po.
Okay. And then we also need to ask the patient for any previous experience with a skin problem and then related systemic conditions. Okay, sir, meron po ba kayong experience na recently or previous na skin problems?
Wala po, wala po.
Okay. And then we also need to assess for the use of any medications, lotions, and home remedies. Okay, sir, gumagamit po ba kayo ng any medication, lotion, or mga home remedies?
Lotion po.
Okay, lotion po. And then also, we need to assess for the excessive dry or moist feel to the skin of the client. Okay, sir, nararamdaman niyo po ba na ang skin niyo is sobrang dry or sobrang basa or moist po?
Hindi naman po.
Okay, sir, thank you po. And then also, we need to assess for the client if the client has a tendency to bruise easily. Okay, sir, mabilis po ba kayo magkapasa or pasain po ba kayo?
Hindi naman po.
Okay. Also, lastly, we need to assess for any association of skin problems in relation to the seasons of the year. So, sir, pag malamig po ba, sobrang nagda-dry yung skin or nagda-dry po yung skin nyo? Also, pag mainit po, masyado po bang nagbabasa or masyadong moist? Okay, sir, thank you. So after gathering or determining the client's history, we will now proceed to the assessment of the skin. But first, let me perform hand hygiene and wear my examination glove. However, before wearing my examination glove, first I will assess or inspect and palpate for the skin moisture, and I will also palpate for the skin temperature of my client, and I will compare both 2 hands and 2 feet using the back of my fingers. So So I will start now.
Sorry ka naman.
After that, based on my assessment, the skin moisture and the skin moisture is just fine, and the skin temperature of the client is warm, which is also fine or good. Now we will proceed to the inspection of other things, and I will first wear my examination gloves. So first we will inspect the skin color, and as we inspect the skin color, we will also inspect for the uniformity of the skin color. And also, we will inspect for the and palpate for presence of any lesions. Good po. Good po. Good po. So, as assessed and as before, based on my assessment, the skin color of the client is light brown or brown, and it is uniform on the visible part of the skin. Also, the skin has no presence of any lesions. But if the client has presence of any lesions, make sure to use a glove because there are lesions that are open and draining, and also palpate the lesion for its temperature and for its shape. And also, after that, we will now proceed to the assessment of the edema of the skin. So based on my assessment, there are no edema present on the skins or the skin of the client. But if there are edema present on the skin, make sure to determine the location, the shape, the color, and the temperature of the edema, and the degree at which the skin remains indented or pitted when pressed by the fingers. So I will demonstrate you the proper determination of the size of the degree of the edema when pitted, or the degree of the edema as it remains pitted when pressed by the fingers. So if there is an edema, you will press it like that, and then you will, using a millimeter ruler, you will determine the depth of the edema like this. Now, after that, we will also note for the skin turgor are the fullness or elasticity of the skin by lifting or pinching the skin on an extremity. In my case, I will note the skin turgor under the clavicle of the patient. So based on my assessment, the skin turgor is just fine and good. After doing the assessment of the skin, we will now remove our gloves and perform hand hygiene. And then we will document any findings or all of the findings in the client's records. After assessing the skin, we will now proceed to the assessment of the hair. First, we need to determine the client's history of the following. First, any recent use of hair dyes, rinsing, curling, straightening, and other hair treatments. Okay, sir, nagkaroon na po ba kayo ng other hair treatments, pagkukulay ng buhok, or straightening or curling?
Hindi po.
Okay, sir. Also, we need to determine if the patient is undergoing chemotherapy session or what is the recent chemotherapy session of the patient. Okay, sir, nag-undergo po ba kayo ng chemotherapy? Okay, sir. Also, we need to assess for any recent or serious illness of the patient. Sir, meron po ba kayong presence of any disease or serious illness?
Wala po.
Okay, sir. Now, after doing the client's history gathering, we will proceed to the assessment of the hair. First, let me perform hand hygiene and let me put on my examination gloves. Now we will inspect for the hair we will inspect the scalp for the evenness of the growth over the scalp. And then we will inspect as well the hair for its thinness or thickness. Also, we will inspect the hair for its texture and oiliness. So let me start. So the growth of hair over the scalp is even, and the hair's thickness and thinness is also balanced, and it's also fine. The hair's texture is smooth, and the hair's oiliness is just fine as well. Also, we will need to inspect the scalp and palpate it for any presence of lesion. And also, we need to inspect the hair and the scalp for the presence of lice or nits. We should note the presence of the infections and infestations on the hair by parting the several areas of the hair and checking behind the ears and along the hairline at the neck. So let me just inspect and palpate. So there are no presence of lesions, and there are no presence of lice and nits all over the hair and the scalp. So there are no infestations as well behind the ears and along the hairline at the neck. Also, we need to check for the amount of the body hair, the client. Sir, let me just check the amount of your body hair. Sir. Okay, sir, thank you. And the amount of the body hair of the patient is just fine. After doing the assessment, we need to remove our gloves and perform proper hand hygiene. And then we need to document all of the findings on the client's records. Now that's all for assessing the hair of the skin and the hair. We will now proceed to the last assessment, which is the nail. But first, we will need to determine the client's history of the following. Okay, sir, meron po ba kayong diabetes mellitus?
No.
Meron po ba kayong any present of peripheral circulatory disease? Meron po ba kayong previous injury?
No.
Meron po ba kayong serious illness or disease?
No.
Okay, thank you po, sir. After that, we will now proceed to the assessment, but let me perform hand hygiene and let me wear my examination glove. Now, we will inspect for the fingernail plate shape to determine the curvature and the angle of the nails. Okay, sir, let me just check. Kabila po. So, the curvature is just fine. And the angle is at 160 degrees, which is also considered normal or fine. Now we will inspect and palpate the fingernail and the toenail for its texture and then for its bed color. Okay, sir, sa inyong fit naman po. Okay. So, based on my assessment, the patient's or the client's fingernail and toenails texture is smooth, which is fine, and the bed color is pink, which is also considered fine and good. Now we will inspect the tissues which surrounding the fingernails and the toenails. So let me double check it using my magnifying glass. Sir, yung fit naman po. surrounding the nails is intact and there are no hangnails or there are no abnormal findings and there are no cuts. Now we will palpate the nails or the fingernails and the toenails of the patient. So sir, sabihin niyo lang po kung masakit kapag po pre-nas ko po, okay? So there are no pain or there are no pain complaints from the patient as I palpate the fingernail and the toenails. And now we will perform the Blanche test of capillary refill, in which I will press 2 or more fingers between my thumb and my first finger, and I will inspect and I will look for the blanching and then the return of the pink color onto the nail bed. And I will now start. Sir? Okay, sakit niyo naman po, sir. Okay, sa kabila ko. So as I perform the assessment or the Blanche test of capillary refill, I assess or based on my assessment, the nails of the patient or the client, both fingernails and toenails, return to its pink color, which is considered fine or good. And then, after doing the assessment, we will remove our gloves. We will perform hand hygiene, and we will document all of the findings to the client's records. Now for the evaluation, perform and conduct a detailed or thorough follow-up examination with other individual systems that deviated from the expected or normal for the client, and make sure to relate the findings on the previous assessment data if it is available. Now, that's all for the assessment of the skin, hair, and nails. Thank you.